So I want to share a story with you today of a patient that I saw last week. I do a lot of hormone replacement therapy, and this is the kind of patient that I see all too often. And I think that it's primarily due to a lack of education. I myself was not educated in the world of hormones. So it is something that I just think that it either needs to be added to the current medical education plan. I just think that we need to do a better job. So this patient came to see me last week. She's a female patient, 54 years old, and she had been seen several times over the past several years. Just a little quick history. She had had a hysterectomy in 2022, and ever since that time, she'd been struggling with poor sleep, lack of energy, and low libido. The libido issue becoming worse, where it's now affecting her relationship with her husband. So she came to me with these complaints and had told me that, she had been prescribed several different medications, and these medications were not alleviating the symptoms. So she had come to me primarily to see if I would do lab work. Lab work to me is like, you get such information in terms of, well, is there a problem? Do you have low this? And when I say low, I mean, on the low end of normal. So automatically I know that certain things are going to come back a certain way because this patient had a hysterectomy. So, and a lot of her underlying things are due to her having a hysterectomy. This patient in particular had asked to have her hormone levels checked, in particular her testosterone level, which she feels is very related to her low libido and low energy. So I told her I could absolutely check those levels. And she had told me that the previous providers that she had seen would not do those levels because they wouldn't do anything about it. So to me, that's not having enough education. You don't know the benefits of replacing testosterone when levels are low. So I feel like it should be your duty, just like if I were to see a patient that has cancer and I can't treat it, I would refer that patient to someone who could treat it. So I just think as providers, if we don't know how to currently treat something, we should definitely give the patient tell them that we're not able to do it, but to please look for a hormone replacement specialist so they can help you, because this is I feel like a deficiency in the system where we just brush off hormones, and it's a big part of our well-being, and I feel like it is something that patients just need to be referred. So if you have any comments or questions, please add them below. If you've had issues with finding a hormone replacement specialist, in the comments, I can respond and let you know, because there are a lot of providers out there. You just have to find them. So thank you for tuning in, and subscribe for more.